Type 2 diabetes is a common and devastating disease that causes damage to other areas of the body and can result in serious conditions such as stroke and heart disease. Making simple changes to your lifestyle can significantly decrease your risk for developing type 2 diabetes. The effect of type 2 diabetes on health and well-being can be significant. Some simple lifestyle modification strategies will help to prevent and mitigate these adverse effects. Currently, 1 in 11 people have a diagnosis of type 2 diabetes. 1 in 3 have prediabetes, and without intervention, 37% of them will develop type 2 diabetes. If you've had a recent blood test that indicates you're pre-diabetic, implementation of the interventions we're about to discuss can decrease your risk of developing type 2 diabetes by 58%. Type 2 diabetes is a chronic disease that inhibits your body's ability to absorb and use sugar. Prediabetes precedes type 2 diabetes. In prediabetes, your blood sugar level is above normal levels, but not at levels representative of type 2 diabetes. A common blood test ordered to diagnose diabetes is the hemoglobin A1C blood test. The hemoglobin A1C test represents the average blood sugar result over the last 3 months. The chart shown here illustrates 3 different blood tests and the criteria used in diagnosis of prediabetes and diabetes. Ask your doctor for more information about these tests. In type 2 diabetes, uncontrolled blood sugar levels can cause damage to blood vessels and nerves throughout the body, which can lead to other complications such as heart disease, kidney disease, loss of vision, and stroke. 50% of those diagnosed with diabetes sustain peripheral nerve damage, which can result in chronic pain to your feet and hands. And 30% of patients with diabetes develop diabetic-related kidney damage, which is the #1 cause of kidney failure. Diabetes does not just result in devastating physical complications, but also financial consequences. According to the American Diabetes Association, an individual with diabetes spends approximately $13,700 a year in medical costs, which is 2.3 times more than what a person without diabetes would spend. So how can you decrease your risk for type 2 diabetes and avoid the serious health and financial consequences? By exercising, eating healthy, and losing weight. Developing an exercise plan that is realistic for you depending on your physical ability and time limitations is vital. A minimum of 30 minutes a day, 5 days a week, should be reserved for your exercise routine. The exercises performed should be moderately intense and increase your heart rate. Examples of moderately intense exercise include running, brisk walking, and aerobics. There are many online exercise videos available that you can follow along with. Work with your doctor in deciding which exercise plan is the best one for you. A healthy diet is also very important in preventing type 2 diabetes. As a rule, you want to eat more vegetables and fiber and minimize your intake of red meat, sugary drinks, and carbohydrates. Example of carbohydrates include rice, pasta, and breads. Foods high in fiber include nuts and seeds, raspberries, pears, and apples with the skin on, and broccoli. Ask your doctor about a referral to see a dietitian. A dietitian can help you develop a realistic meal plan that is individualized and consists of foods you like. Start small as you begin your journey to eating healthier. For example, instead of eliminating rice completely, try brown rice. When possible, choose broiled or baked over fried. Visit the CDC diabetes website listed here for smart eating tips and recipes. Follow the plate method during meals. Using a 9-inch plate, ensure that half of the plate is filled with non-starchy vegetables, 1/4 with starchy vegetables or whole grains, and another quarter with lean protein. Achieve a healthy body mass index of less than 25. Body mass index, or BMI, is a measure of body fat in adults obtained through your height and weight. It can be calculated using this equation. You can access the online calculator through the link. There are also free apps for calculating BMI available for smartphones. Write down a specific plan that includes your exercise routine, meal plans, and weight loss plan. Include realistic goals that you hope to achieve in a specified time frame and stick with your plan. You have the ability to prevent the onset of this debilitating disease through these simple lifestyle changes. So implement those changes now and decrease your diabetes risk by 58%.